Hey there, welcome back to our YouTube channel. Today we'll discuss what oligohydramnios is, its causes, symptoms, diagnosis and treatment options. What is oligohydramnios? Oligohydramnios is a condition that occurs during pregnancy when there is too little amniotic fluid in the uterus. Amniotic fluid is a clear, slightly yellowish liquid that surrounds the baby in the uterus during pregnancy. This fluid helps to protect the baby from injury and infection, as well as providing a cushion for the growing fetus. Oligohydramnios can cause a number of problems for both the mother and the baby, and can lead to complications if not managed appropriately. Please like and subscribe to our channel and click bell icon to get more health updates. Causes of oligohydramnios during pregnancy. Fetal kidney problems. The fetal kidneys are responsible for producing urine, which is the primary source of amniotic fluid. If the fetal kidneys are not functioning properly, the amount of amniotic fluid may be reduced. Ruptured membranes. The amniotic sac can rupture before labor begins, causing the amniotic fluid to leak out of the uterus. Placental problems. The placenta is responsible for supplying the fetus with oxygen and nutrients. If the placenta is not functioning properly, the amount of amniotic fluid may be reduced. Maternal health problems. Certain maternal health conditions, such as hypertension and diabetes, can increase the risk of oligohydramnios. Intrauterine growth restriction (IUGR). This is a condition where the fetus is not growing at the expected rate, which can lead to a reduction in the amount of amniotic fluid. Post-term pregnancy. If the pregnancy goes beyond 42 weeks, the amount of amniotic fluid may decrease. Multiple gestation. If a woman is carrying twins or other multiples, there may be a higher risk of oligohydramnios. Symptoms of oligohydramnios. In the early stages, oligohydramnios may not cause any symptoms, but as the condition progresses, the following symptoms may be experienced. Reduced fetal movements. The baby may move less than usual. Maternal discomfort. The mother may experience discomfort due to the reduced amniotic fluid cushion. Abnormal fetal heart rate. The baby's heart rate may be abnormal. Uterine contractions. In some cases, oligohydramnios can cause uterine contractions. Abnormal position of the baby. The baby may be in a breech position due to the reduced amount of amniotic fluid. Diagnosis of oligohydramnios. The diagnosis of oligohydramnios during pregnancy is typically made through an ultrasound examination. During the ultrasound, the depth of the amniotic fluid is measured, which is known as the amniotic fluid index (AFI). An AFI of less than 5 cm is generally considered to be diagnostic of oligohydramnios. In addition to the AFI, the ultrasound may also evaluate the fetal kidneys, bladder, and other organs to determine if there are any underlying causes of the oligohydramnios. In some cases, additional tests may be performed to determine the cause of the oligohydramnios. These tests may include amniocentesis to analyze the amniotic fluid for signs of infection or chromosomal abnormalities, and Doppler ultrasound to assess blood flow to the placenta and fetus. It is important to note that a single ultrasound measurement of the AFI may not be sufficient to diagnose oligohydramnios, as the amount of amniotic fluid can fluctuate throughout the day. Therefore, your healthcare provider may perform additional ultrasounds to monitor the amount of amniotic fluid over time. Oligohydramnios treatment options. Close monitoring. In cases of mild oligohydramnios, your healthcare provider may recommend frequent ultrasounds to monitor the amount of amniotic fluid and fetal well-being. Amnioinfusion. This is a procedure where sterile fluid is infused into the uterus to increase the amount of amniotic fluid surrounding the baby. This may be done if there is concern about the baby's well-being due to the low amount of amniotic fluid. Delivery induction. In cases where the oligohydramnios is severe and there is concern about the baby's well-being, delivery may be induced. This may be done before the due date if there is a risk of complications. Treatment of underlying conditions. If the oligohydramnios is caused by an underlying condition, such as maternal hypertension or fetal kidney problems, treatment of that condition may help to increase the amount of amniotic fluid. It is important to note that the treatment plan for oligohydramnios is highly individualized, and your healthcare provider will work with you to determine the best course of action based on your specific situation. In some cases, the condition may resolve on its own without intervention. Regular prenatal care and monitoring are essential to ensure the health and well-being of both the mother and baby. Thanks for watching. Please do like, Subscribe and click bell icon for more health videos. Also lets us know, how would you want us to improvise videos, or which health condition you would like to explore in comment section.